I am Arika Hoffman. I'm originally from Kalamazoo, Michigan. I did my general surgery training at Henry Ford Hospital in Detroit. I then did a fellowship in abdominal transplant surgery at the University of Alabama in Birmingham, Alabama. When I was in high school, I knew I wanted to become a physician. My father's a cardiologist, and so I knew early on, spending time with him in the clinic, that's what I was interested in. He loved his patients, he loved his job, and I wanted to do something that I enjoyed. But more than that, I enjoyed anatomy, I loved science and solving problems, and I wanted to devote my life to taking care of people. I knew that I was going to go into surgery the first day of my clinical rotations. Really, it was the only choice for me because I was able to do a specialty where I can take care of complex patients. I use my hands basically every day. Transplant surgery for me was an easy option. When I was a resident at Henry Ford, there was an attending who told me there are only two reasons why patients love to come to the hospital. One is to have a baby, and the other one is to get a transplant. And I wanted to be part of why patients enjoyed coming to the hospital. Transplant surgery is a rewarding and humbling profession, and being part of an academic hospital is especially rewarding and humbling. I'm able to teach residents, students, and fellows, but not just that, I can perform clinical research, and that allows for patients to be on the forefront of their care. It's cutting edge technology, so transplant patients receive the best care when they're taken care of at an academic hospital. I take care of and see patients who are either on or nearing dialysis, patients who are in need of a kidney transplant or perhaps a pancreas and a kidney transplant. I also take care and see patients who need permanent dialysis access. I perform that operation as well as the transplant for them and take care of both adults and children. So when I see a patient in clinic for the first time, we talk about transplant. For them, all of them have a story, and I want them to be able to tell me about themselves. I want them to be able to ask questions and to feel comfortable with their operation. For patients who we call and tell them that we have a kidney for them, it's usually at 2 a.m. So in clinic, I want them to be able to be comfortable with the decision to proceed with kidney transplant. We also see patients who would like to donate a kidney to a family member or friend, and seeing them in clinic is also important because they need to know that their decision and life is valuable and what they were doing is extremely important, but that they also need to feel comfortable with the decision to donate a kidney. So those are the things that we talk about in clinic.